name is Elena Arredondo, and I'm a civil engineer working as an innovation project manager in the innovation unit of Hospital Clínico San Carlos, SERMAS, Madrid.
My name is Ignacio Martínez, and I'm a biomedical engineer and data scientist, and I also work in the innovation unit of the Hospital Clínico San Carlos.
As a member of the innovation unit of the Hospital Clínico San Carlos, one of my activities is to participate in programs to bring innovative technologies to the healthcare environment. That is why participation in projects such as COVID-X is enriching from several points of view, as it favors interaction at European level between small companies and high-level hospital centers.
Yeah, as my colleague has said, I think it brings together two very different worlds. On one side, there is the side of big public institutions, such as hospitals, which have the data and have the patients, but are very slow to react to crises, such as the pandemic. And on the other side, we have small startups, which have this agility to develop and provide technological solutions, but lack the data to do so. So programs like COVID-X are a huge opportunity to close this gap.
Well, on a personal level, it is rewarding to be part of this project because of the heterogeneity of the participants and the common interest among all of them to fight against COVID-19. On a professional level, the interaction with more than 100 small European companies and their inclusion into acceleration program has been very enriching and dynamic.
We've had the opportunity to learn a lot in terms of the legal frameworks around data protection and ethics, because we've been responsible for that part of the project. We've learned both from a theoretical perspective, but also from a practical one, because we've had to develop and write the documents, but also working with new software tools to ensure that the data that's being used by all the team members had the adequate level of protection. So it has been very, very interesting.
The experience has been quite positive, as my hospital has provided clinical input to improve the validation of the technology developed by Elena's team.
Not also that, but it has been really nice to see how passionate the small team of a startup can be with their work, and how they really want to make an impact in the health domain. And in fact, we are so happy with the work of one of the solutions that we are in the middle of conversations with one of the services of the hospital to deploy that solution here. So let's hope that that goes well, because we are, again, really, really happy.
I think that it increases awareness of innovative technologies being developed at European level, thus enabling the accelerated introduction of such technologies in the healthcare environment.
Yeah, because the healthcare environment is a little bit reluctant to changes, but it is clear that the use of these new technologies is the key to bring health to the next level. And the solutions developed during this project, during COVID-X, are showcasing how that future is going to look like. No? We have telemedicine, we have the use of artificial intelligence to detect diseases, or technologies to augment the capabilities of hospitals. So I think that healthcare providers should use these technologies and should profit on projects like this.
Well, the main impact has been to increase knowledge about COVID-19 and the different ways to fight it. At the same time, we have created evidence with regard to the following aspects. First, how the integration of multidisciplinarity profiles improves the solution reach. Second, how the use of data accelerates the achievement of the solution. And finally, how a common European policy and regulation on the adoption of artificial intelligence-based technologies in the healthcare environment is urgently needed.
have nothing to add. I think you explained it perfectly.